That's okay. I'll do it again. I'll do it again. There's no sound, no sound. Okay. All right. And we are back. And we are back. Welcome to Monday Motivation. Hi, my name is Professor Regina. If you are taking the NCLEX exam, you need to be in this class because one of the things that people believe is that the hardest part about passing NCLEX is actually passing NCLEX, but it's not. The hardest part is making sure that you're starting off on the right foot, making sure that the way you're preparing is actually going to lead you to results. So I'm going to be talking about that today, making sure that you get prepared. If it's your first time joining me, hi, my name is Professor Regina. Again, the number one NCLEX instructor on the planet. I love what I do. Every Monday, I am here for you, 12 p.m. Eastern time, so that we can continue to improve your critical thinking and most of all, give you direction on what you should be studying and what you should not be studying, because that's just as important. So today, we're going to talk about Reye syndrome. Yeah, we're going to talk about Reye syndrome. And another thing that we have to focus on is knowing how we're going to prepare ourselves, because I think that if we spend too much time on the constant, okay, look at this, look at this, look at this, and not how do we apply it, then we might be in trouble. So we're going to learn to apply the information that we're studying. Okay. Also, just as a housekeeping, when we come to these classes, our focus should be on improving and increasing our understanding of what we have been studying. So we will be studying from quick facts today, the pathophysiology. Yes, the pathophysiology is done in quick facts. That means you understanding the topic that has to take place honestly before you come to this class, because we're going to be applying it. So if you have quick facts, page 77 is where you'll learn about the foundations of the pathophysiology of Reye syndrome. Today is our topic. And really, to be honest, you cannot critically think without the facts. You cannot critically think about something that you have not understood what's happening. So, hey, everyone, I see where we're from. I got Grenada in the house today. I don't see Grenada too much. I'm so happy that you're here. Kenya also representing. My U.S. nurses come out in abundance. Today is St. Patrick's Day in the United States. So happy St. Patrick's Day to everyone who will be celebrating. You know, we study on all the holidays. We rarely take days off. So shout out to everyone from all over Guyana. I see you, Oregon. Crystal says on this morning, good afternoon. It is good afternoon. Yeah. ReMar family, I just want to thank God for allowing me to pass NCLEX last Wednesday. My favorite words ever. I'm officially a ReMar nurse. Whew. Congratulations, Crystal. I know that feels so good. I know it feels so good to be able to come back here and say, I passed NCLEX. You know, I love to ask, who's next? Who's next? Okay. Nurse Nicole says, my nursing school was using ATI. We know that's so common. I did not understand some of the context until Nurse ReMar. I am so grateful to have that opportunity. As I'm working more with nursing schools, Nurse Nicole, I know that I'll be helping you much, much more. And so stick around, come to class. All right. So we're going to be talking about the critical thinking aspects that is coming from quick facts on today. We're going to be applying it. You're going to really love the class and the approach that I'm taking. As also for my nurses who are achieving that 100K a year, the way that I'm supporting you to do that is through travel nursing. It is possible. It is possible to achieve that. And this is, of course, for my nurses with experience, those of you who've been working. Wednesday nights at 7 p.m., we discuss how you go about travel nursing so you don't make the pitfalls that are common. We are also presenting you those jobs that are allowing you to get to that financial goal. If you're trying to make $100,000 in travel nursing, one of the best places that you start is with your job offer, because you have to do negotiations. Sometimes you have to say, well, can I do this? Can I do that? So the jobs that we have for this week are guaranteeing you 10K a month, which will allow you to meet that $100,000 goal. All right. So we got to be strategic. We got to be smart, but all the jobs that are coming across my desk are going to help you get to that goal. So Wednesday at 7 p.m., keep it locked right on here, this channel. All right. Speaking of traveling, I have to let you know that I am also called the Thriller in Manila. Yes, I am going to the Philippines. I told y'all, #1 NCLEX instructor on the planet. That means that I travel all over the planet to prepare nurses for NCLEX. I don't allow the barrier of location to stop me. I'm for real. I'm a for real person. I do this. I do education all over. So I will be traversing the Philippines. So excited. It'll be my second time coming back to Manila, but I also will be adding Baguio. I'll also be adding CDO, Cebu. I'm going in. I'm going to teach the nurses in the Philippines how they should be approaching NCLEX, because did you know that Filipino nurses, they learn better using certain techniques? And this may make sense to you because culturally, the way that we have our advantages in the way we think should be applied to our education. And NCLEX is no different. So, oh man, I am so looking forward to this masterclass. I'm calling it a masterclass because once they go to it, anybody that attends it, they won't make the mistakes that that most nurses in the Philippines are making. Okay. So yes, I plan to go to, I plan to be in the Philippines the entire month of April. You guys will be with me on this trip. I'm actually celebrating my mom's 65th birthday there. So I'm bringing my mom, I'm bringing my kids, and we are making the trip 17-hour flight, 17-hour flight to the Philippines. I also will be, I will be visiting other countries after that. So they're coming, but Philippines is the start. So yes. All right. Now let's get into, again, everything that I'm preparing you for. My goal for you is to understand the simplicity of the V2. The NCLEX exam is challenging because it is going to come at you from every angle, right? It is going to evaluate your knowledge for maternity, for psychiatry, for pharmacology, for critical care or acute care conditions. And so what I have designed is a simplified system that offers you every touch point to be successful, no matter what the exam throws at you, okay? And the system is comprised of this, all right? So you're going to get 2 books, okay? 2 books, I should say 2 books, quick facts for NCLEX, plus the V2 workbook, okay? These are the major physical components of ReMar V2. And you all know that right now, everyone wants to do things digital. And so physical books are rarely seen when it comes to NCLEX prep. I've retained these books because this is where you retain the most information, what you write down, what you have in your hand, okay? So these 2 books, do you have them? Okay, plus the 1 video course that I have. 1 video course straight to the point, what you need to know. Not what you might need to know, but what you absolutely need to know. And then you have the NGN question bank. If you have all 3 of these components, you have my complete system equals your nursing license, okay? Passed with ReMar, okay? Somebody says, I have both, I have it perfect. Yes, both. That's what I'm talking about. When you are doing ReMar, you are doing the 3 components: 2 books, 1 video course, 1 NGNQ bank. You got it? Perfect. All right. So let's get into it. We're going to look at one of the books today, which is Quick Facts for NCLEX. We're going to talk about Reye syndrome. Now, when I am looking at Reye syndrome is on page 77. I was here last night. I did my notes on it, but I have to go back over it. I'm using Quick Facts as a workbook, just as anything else. I love writing in Quick Facts. I used a pink pencil yesterday, so I have to go back over it. But when we are talking about Reye syndrome, one of the things that I really wanted to focus on is what do I say? What is the condition? The condition is Encephalopathy, all right? And this right here is one of the defining characteristics of Reye syndrome that makes it different than other conditions. All right. So we got to understand that this is typically seen where in pediatrics. So in pediatrics, where would we find this patient? Okay. Based off of what you know. Based off of what you know. So are we going to find this patient on a surgical floor? Are we going to find this patient on a med surg floor? Give it to me, guys. Yes, it's brain, it's a brain issue. That's one of it, right? But where would we find this patient? Yes, absolutely. And I wrote this down here for you when you're reading this, entire page, everything that I say to you is important. So yes, we're going to find this patient in the ICU. We're going to find this patient in the ICU. Why is that? Okay. Why is that? What's happening with this patient? What do I say? Okay. What do I say? Now, the surface level, most people who study, they'll say, well, this is what happens when you give children aspirin after a viral infection. And that's good if you're recalling just general information, but we're going to go deeper because there's so much more here. I don't want you to miss it. So I'm going to present to you, absolutely, I'm going to present to you just what most people are going to tell you, right? Reye syndrome, acute hepatic failure and encephalopathy. It's going to happen in children ages 4 to 12, and it's associated with aspirin use during a viral infection. And this is where most reviews stop. And they will say, well, as long as you know this much about it, you are good. However, NextGen NCLEX is not like a regular multiple single choice nursing school exam. They're going to present to you concepts that are going to challenge if you actually know the depth of the nursing care for this patient. Because like I said, this patient is in the ICU. So that means that this patient is receiving treatments and the nurse needs to be aware of what is coming down the pipeline so she can intervene quickly. So I wanted to do today a case study that I wrote from the Quick Facts book. And it's here. Here we go. Are you guys ready? I want to see comments on the screen. A 14-year-old presents to the ER with Reye syndrome by his parents after experiencing persistent vomiting and confusion following recovery from the flu a week ago. Okay, so if we're here in a case study presentation, we have a 4-year-old. Do 4-year-olds get Reye syndrome? Absolutely. Okay. This child is having persistent vomiting and confusion. What's causing that? You know. What's causing it? What's causing persistent vomiting and confusion? Look in your quick facts. Tell me what you see in there. The organs that are essentially failing are what? Good job. Good job. Okay. Yes, this patient. Now we have to be careful because I can tell here that you are reaching a little bit. You're reaching a little bit in what's going on. Natalie has it. So we know the patient has a problem with their liver. Okay. They're going to have a problem with their liver. What's happening to their liver? It's beginning to fail. Is that causing the vomiting? Probably. Confusion. What is happening? Kidneys. All right. How can I help you? I'm sorry, my kid just walked in on my live. You're doing amazing, Mom. Thanks, babe. Thanks. Okay, but you can't just be busting in. I'm in the middle of class. Sorry. Okay. All right. I will. Salome says hi. Okay, so you're having an issue with the liver failing, the kidneys not working, and so your patient is essentially filled up with toxins. All right, they're starting to become unstable. Yes. All right. And so here's my question here. This is the blood work. What do we notice? What do we notice about our patient? And do we see something on here that is unexpected. Because remember, NCLEX, they're going to give you the lab results. They're going to give you the normals because they don't care about that anymore. They don't care whether you can memorize what's the normal AST, what's the normal ALT. That means nothing if you cannot apply it to the actual condition. So we know why these liver enzymes are elevated. Okay, we know the liver is shutting down, it's not working. We also know, hey, because the liver, very vascular, is having issues, we know the bleeding time is going to be elongated. The ammonia level comes by way of what? Because you're having hepatic failure. Yep. Glucose, patient is vomiting, glucose is low, patient's nutrition is not right. This is a child, this person. And the thing about it is, with Reye syndrome, it is a metabolic condition. Now, for people with the V2, if a patient has Reye syndrome and you had to guess what was their blood gas interpretation, give it to me in the comments. Is this going to be a respiratory alkalosis? Is this going to be a metabolic alkalosis, metabolic acidosis? Give it to me right now. What will we put in the comments? I want to see it. And again, this is how you go from just being able to surface level explain something or recognize something to being able to really take control as a nurse. And that's the safety that is required with the NCLEX. Okay. All right, I got it. I see it. Y'all are showing up today. Lots of comments on the screen. And because we're doing this in a way that is really, really getting to an assessment, I want you to share this video. Do me a favor, share the video, like the video. All right. We got 500 people watching right now. That means to tell me that you are interested in knowing this information. You're interested in learning how to critically think. So metabolic acidosis, very good. Now, you know that? Nice. What about this? Why would the doctor order a lumbar puncture for this patient? Why would the doctor order a lumbar puncture? What's going on? What are we going to investigate with a lumbar puncture? What's the lumbar puncture tell us? Specifically for Reye syndrome, what are we looking for if we do a lumbar puncture? To check for, to assess fluid, to cerebrospinal fluid. Okay. Yes. But why? What are we actually looking for in this patient? Because remember, our patient's coming in nausea and vomiting and confusion. Okay. To check for fluid, to remove fluid, to examine the fluid. Okay. All right. So we're looking for differential diagnosis. We're looking to see, somebody said meningitis. If it is a condition of meningitis, right? If there's infection, we're looking at the fluid, we're looking at the glucose level, increased intracranial pressure. Absolutely. Absolutely. So we would absolutely expect the lumbar puncture to be done. And more than likely, the parents are going to say, no, do y'all have to do this? I mean, because, there are issues with lumbar punctures. We have to do the risks and the benefits. The parents may want to refuse a lumbar puncture on their child. And they may say, no, this is not that serious. No. Like he just had influenza. Like we don't want to do this. A lumbar puncture is very important in this scenario. Good job. Okay. And also because look, the patient has elevated ammonia levels and the liver enzymes are off. So we want to know, okay, is this a true Reye syndrome, or are we dealing with some sort of something else, right? To rule out conditions. Yes. Good job. Okay. My nurses are here today. Let me ask you this question. In true Reye syndrome, will there be swelling and inflammation, encephalitis? Give me a yes or no in the comments here. We are talking about how to apply. We're talking about how to apply information to true critical thinking. Okay, one second. This is so good. People are literally saying, hey, yes. I'm so glad y'all came to class today. I really am so glad. Everybody's saying yes. Rachel saying, I need those books. All right, I'm letting you, I'm hearing everybody put the right answer. I'm waiting to see if everybody's on the same page here. I have one person, I have a couple people actually putting no. I have some people putting yes. I have more people putting no. Okay. All right. So what I wanted to do, and I was actually looking here too, in quick facts, you have to be so careful. You have to be so careful. The correct answer for Reye syndrome or Reye syndrome is no. You will not have, and watch this. This is very important because this is how somebody can show up and say, I studied everything. I knew everything. Why did I fail NCLEX? Because NCLEX is going to be very particular about foundational information. And so I asked the question, will you have encephalitis with Reye syndrome? You will not. You will have the swelling. But in here, will you have inflammation? Will you have inflammation in the brain? No. There is a difference in those two terms. Make sure you know them. Okay? Make sure you know them. Because what we have been talking about is edema. Why is there edema? We can draw the connection to edema, right? We can draw the connection to edema because we know that the kidneys are failing and the liver is failing. So the swelling makes sense. That's where the cerebral edema is coming from. Okay. Encephalitis means that there is some sort of inflammatory response that is happening because of that. And encephalitis is usually going to, I don't want to get too ahead of myself. Okay. I'm on page 77. But this is why I say reading is fundamental. Reading is fundamental here. And I don't want you to look at quick facts and be like, oh yeah, it's too, it's too simple. I need more. No, most of us don't need more. Most of us need this. Okay. And I can see why the questions are asking, where does the swelling come from? The swelling goes back to the pathophysiology. You have liver, you have kidney failure. So are we going to be putting out a lot of urine for this patient? No. Okay. There we go. You guys are tracking me. Okay. So no, encephalopathy and encephalitis, two different things. Let me ask this question here. Does the nurse expect an order for diuretics? If so, which one? Okay. Are we in a position to give this pediatric patient diuretics? Okay. Correct answer, yes. Which diuretic? Because that's something that's going to be absolutely important to know. Because you wouldn't want to give a furosemide with this patient, right? All right, good job. I see it there. Not furosemide. We would want to give mannitol. Mannitol. Yes, that's the one for NCLEX that you need to know. And you absolutely need to be able to make that connection. Why? Okay. All right. What else do I have here? Case study time. It's going to be mannitol. That's going to be the best one. Okay. Good job. Now, let me ask you this. Would corticosteroids help this patient? We're talking about a patient that's coming in. You know that they have Reye syndrome. Would we want to give a boost? Would we want to give corticosteroids? Would we want to give this type of hormonal support to the patient? And put it together. Put everything you know about this patient. together. Okay. And if you got this one wrong, if you get this one wrong, you missed the entire point about us deep diving into Reye syndrome. So the correct answer would be no. Okay. No. We would not want to give a corticosteroid to this patient. Why? Because it's going to make the patient worse. Okay. Our patient is essentially having cerebral edema. There is no inflammation here. Remember, we went back to it. It's not an inflammatory process. It's a water issue. So if we pump our patient with steroids, is that going to make them better or worse? Right? Ooh, corticosteroids. Good job. Oh, no. It's going to make them worse because, and I like who said that, Ivar says steroids retain water. It's going to make the swelling worse. Ooh. Okay. And so listen to me very carefully. If you want to practice and get paid money and be able to go and travel and do all these things, this is the basic information that you need to be able to make the connection to. Y'all, it's so much deeper. Okay. It's so much deeper. And I love the question banks and I love, I love question banks and I love that stuff. But this is the work that you need to do before you start doing unlimited CAT exams. All right. Before you start looking for CAT exams and all kind of assessment tests and readiness tests, no, you need to just read. Okay. You need to just read because you got to make these connections. All right. So I'm going to wrap it up really quickly, but for the diagnostics, be able to connect the reason why the cerebral spinal fluid is investigated. It's essentially looking to determine if there is an infection present. If there's any kind of bacteria present, then this is not Reye syndrome. It's something else, right? And so you can't have Reye syndrome in the presence of bacteria. Don't miss that, because Reye syndrome stems from viruses and not just from the actual virus. You can have influenza, you can have gastroenteritis. That's not the cause of Reye syndrome. It's the aspirin that's introduced that's going to start causing hepatic failure, renal failure, cerebral edema. Okay. So I don't expect to see white blood cells. I don't expect to see that in the CSF fluid. Liver biopsy can be done. It's only done to see that if there's any kind of other toxic presence there. All right. And then brain imaging studies. So make sure you're making that connection. Again, V2 is about watching, reading, understanding. We do these classes so that you're on the right track as you are investigating. When I'm teaching med-surg, I like to just focus on one patient, and I can put 10 different conditions on that one patient because you need to be able to admit all the way to discharge somebody. All right. And I know you can do this. All right. Let's do some NCLEX questions. Now that we have gotten together and gone over the content in a proper way, let me see how you do on these questions. If not, you want to log off, don't log off too soon. Let's do the questions first. Here we go. First question is this. A client is diagnosed with Reye syndrome. Which assessment finding by the previous nurse should be questioned? Number 1, nausea. 2, fever. 3, low urine output. Or 4, rapid breathing. Oh, I love this. I love these classes. I love Mondays. This is such a great way to energize my day and make sure I'm on the right track. I'm asking you here, based off of what you know about Reye syndrome, which are you going to question? If a nurse writes this down, what will let you know that this person has no idea what they're talking about? Okay. It's our responsibility. You have to tell that nurse, listen, you have not studied this. All right. Correct answer, 2, fever. I'm not expecting to see a fever because there is no infection, there is no bacteria, there is no inflammation process happening in my patient with Reye syndrome. I am expecting to see nausea. Patients having a buildup of ammonia probably, right? Patients having toxins that they can't release because they're kidneys. So the body's going to try to dispose of it through vomiting. Okay. I am expecting to see low urine output. I am expecting to see rapid breathing. Now, this one may have gotten somebody. Why? No fever. No fever. Why rapid breathing? Why rapid breathing? Why am I expecting to see tachypnea? What is that rapid breathing going to do for the patient? Oh, catch this, okay? Because this is a big one too. Why is rapid breathing so necessary in a patient with Reye syndrome? And think about what I asked you earlier. Think about what I asked you earlier. It's a this is compensation for what? Yes, 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 yes. Uh-huh, uh-huh. Okay, so don't get it. Oh, the comments are commenting today. All right, the nurses showed up. So the rapid breathing is because your patient is in what? Metabolic acidosis. And so that's a kidney problem. So what is the other organ system that compensates? There's only two, right? You have the lungs and you have the kidneys. So when the kidneys are failing and when they're not doing their job, then the lungs say, okay, I have to speed up breathing or I have to slow down breathing. And because their body is in an acidosis state, the lungs are like, I got to get rid of this acid another way. So I got to help the kidneys out. I got to start making the patient breathe faster to blow off that acid, that CO2, right? And so, the lungs are the faster of the compensation mechanisms. They're going to work within minutes. Whereas there's something wrong with the lungs, the kidneys are going to try to do the job. They're going to try to get it done. Kidneys are going to take longer, couple hours, couple days, but the lungs will get it done. Okay. So that was why rapid breathing is something that we are expecting. Question number 2, let me go to it. Which of the following orders should the nurse prioritize for a client vomiting with Reye syndrome? Here we go. Number 1, administer dextrose in half normal saline as prescribed. 2, provide a high calorie diet. 3, decrease ambulation. 4, place client on oxygen via nasal cannula. Okay. Which of the following orders should the nurse prioritize for a client vomiting with Reye syndrome? Here we go. What are you going to do? I think you figured it out. I think you figured it out pretty quickly. I thought I could try to distract you, but you got it. If you chose number 1, giving that patient some IV fluids. Yeah, giving that patient some dextrose in some IV fluids, and the particular half normal saline, because that is not going to increase cerebral edema. Okay. That is not going to increase cerebral edema. So I have here, once the neurological status of the patient is monitored, the next priority for a patient with Reye syndrome is the administration of IV fluids as prescribed here. So we know that Reye syndrome can lead to metabolic disturbances, and the risk for dehydration is huge. That is one of the, yes, dehydration is deadly. I want you to think about that on NCLEX. Do not take light of. Have any of you ever been dehydrated? Literally, have any of you ever spent a day at an amusement park, or you went to a new city, you went on vacation to the Caribbean, you went to Las Vegas, you went to Africa, you went to the Philippines, you went to Thailand. If you get dehydrated, you're incapacitated. It puts you at risk for organ shutdown. And our patient with Reye syndrome already has that. They already have that going on. So we will be wanting to hydrate these patients. Yes. Okay. How about question 3 here? A child with Reye syndrome is being monitored for the progression of cerebral edema. Which of the findings best indicates worsening of cerebral edema? Number 1, persistent vomiting. 2, the client is speaking more disoriented. 3, the client reports feeling warm and has a headache. Or 4, the client is asleep most of the time. Which one are you going with in this case? 1, 2, 3, or 4? Okay. Answers are rolling, rolling, rolling in. I asked a very straightforward question here. You know the condition. I'm asking you what indicates a worsening of cerebral edema. And the correct answer here is 4, the patient is asleep most of the time. Okay, so cerebral edema can initially be that headaches, that vomiting, that lethargy, but then it's going to progress to coma and then death. And so what you're going to see is a decreased level of consciousness, and you can use that to determine the progression of the disease. Yes. And 4, okay, here's 4. Here's the scenario. Client with Reye syndrome is becoming less responsive, hyperventilating, and presenting decoordinate rigidity. Which of the following actions should the nurse prioritize first? Number 1, administer bolus diuretics. 2, prepare the client for endotracheal intubation. 3, prepare the client for a liver transplant. Or 4, prepare the client for a craniotomy. My. What are we going to do first? What are we going to do first? Okay. This is safety, and this is also clinical reasoning. Clinical reasoning is different from clinical judgment. So I saved this one for last. I'll talk more about it probably maybe on Wednesday. Correct answer here is number 2. Number 2, prepare the client for endotracheal intubation. This client has respiratory distress, becoming less responsive. And so we need to look at the clinical response that is going to stabilize this patient in the best way. Okay. And so we're going to essentially put the patient in position to take over the breathing of the patient. Take over the breathing. That's going to be the priority. Oh my goodness. Didn't we do so? Listen. And this is why I'm finding myself this year in 2025 traveling all over. I literally want to go to the cities. I want to be in a physical classroom. I will be coming to Manila. I've been talking about it because it is so much more that is required for you to be able to position yourself the right way. I know if you position yourself the right way, you got 3 out of 4. 3 out of 4 is not bad. 3 out of 4 is not bad. If you're able to position yourself to think about the information in a certain way, specifically nurses who are non-traditional. So my nurses in the Philippines, you guys are non-traditional nursing when it comes to NCLEX. NCLEX is very much US educated, 19 to, I would say, 27-year-old, acute care primarily, right? And so most people fall out of that range that I'm working with. So if you're coming to my class in any of the cities in the Philippines, please go to remarnurse.com/PH. Also, if you can attend the classes, I'm trying to work out something where we can get you some of the information after the class. So just sign up for it anyways, and I'll try to figure out what I'm going to do for y'all. Okay. All right. But what I want to say is that, I find that once I am in front of you and I tell you, this is what you need to do, and this is what you need to look out for, then you do that. Then you absolutely will be able to do it. But the problem is if you've already started in a wrong direction, or you have a different mindset about how to approach NCLEX, it's more difficult to get you on the right track, right? And I find myself fighting bad habits. I find myself fighting preconceived notions or what somebody else told you or what worked for them. This journey is very personal, right? So what works for other people may not work for you, right? And so I was thinking about this as I thought about myself in nursing school. I struggled a lot through nursing school because I didn't find a community that studied the way that I studied. So I studied a lot by myself. And I would say, even though I felt alone in the journey, it turned out pretty good for me. So don't be afraid to say, I need to do something differently than what other people are doing. Okay. I need to do something differently than what other people are doing. So getting into the V2, taking time out to watch those videos, take notes in your own way is going to be tremendous benefit than you just trying to do little things here or there or mixing and matching. All right. I'm doing this class every Monday, 12 p.m. Eastern time, every Wednesday, 9 p.m. We have a day class, we have a night class. No excuses. You can make one of them. I will always be going over the information in the V2 so that you are sure about what you're supposed to be doing. All right. So you came to class, you got at least a 2 out of 4. I'm proud of you because we approached this information very differently in the class today. Okay. All right. So here it is. Our Monday motivation, this is a very important part of what we do as well. It's called finding joy in everyday life. And I want us to be very intentional about this starting from today because there are some things that you are waiting to happen. You're waiting for your license. You're waiting to, get your CES report, or you're waiting for your grades, or you're waiting to just get through nursing school. But you need to appreciate the little things that you're going through right now because they're going to allow you to develop a character that will make you a better nurse. I cannot stand when I go into the hospital as a patient and I'm sitting there, okay, and I am watching a nurse in the ER because I went to the ER last year because I had food poisoning. I got food poisoning from, never mind, I can't say the restaurant because they might come. But anyways, I had food poisoning. I was in the ER. And the nurse that was taking care of an elderly woman was so nasty to her. She was so mean to this woman. I hadn't been to the hospital in a long time on a general floor. Usually if I'm in the hospital, I'm going there because I'm having a baby. But I was in the emergency room and the nurses were so mean. Like they were just like, the lady was like, can you help me use the bathroom? And she was like, I asked you already if you needed anything else and you told me no. And now you asking me to go to the bathroom. Like it just blew my mind. Like I wanted to get up and take this woman to the restroom, right? But anyways, what I'm trying to say is that you have to maintain a level of humility and gratefulness in this process. Because really, sometimes the people who get it the fastest don't really appreciate it. Oh man. It's so tough. So really, please, are you somebody that appreciates the little things in life? Like listening to your favorite song, being able to find money. Like you ever find like $1 or $5 in like your old purse or something, you're just happy about that. Having a home cooked meal by your mom, by your husband, anybody like that. Just being grateful for being able to have a to-do list and check it off, the things that you do. Oh man. All right. Or being able to be grateful for your family and friends. Are you the type of person who can have that posture? Because it is so important, so important for us to be able to do that. Our scripture reference to keep us thinking about it is this. It's Ecclesiastes. And Solomon, he was the wisest man. He was the wisest man who ever lived. And if you read that book of Ecclesiastes, he will literally say, I've experienced everything you can experience. I've tried everything on this earth. The will of God, the responsibility of man, fear God, give him glory. Like that's his advice. Like if you're not looking for God, if you're not representing God, you missed it. You missed it. Ecclesiastes 12:13 says, I know that there is nothing better for people than to be happy and do good while they live, that each of them may eat and drink and find satisfaction in all their toil. This is the gift of God. And to me, this is saying everybody has their own struggle that they're going through. But during this process of life, and life is hard, life here on earth is extremely hard. We experience things like sorrow, we experience things like death and separation and sickness and pain, right? It's part of our human experience. But in all of that, if you are here today, I want you to understand that you are loved, loved, loved. Every day, right now, in this very moment, God has made it in his will that you are alive right now. And not just by chance, like God intentionally said, you will be in existence. Your mom and your dad will meet. Whether they work out, whether they're married, they stay married, they fall in love, whatever. God purposed that you would be born and that you would be alive on this day. Why? Because he absolutely loves you. He is thinking about you. He is actively putting his goodwill towards you. Your existence declares that there is a God. Okay? I know mine does. I should not be here. I have nothing good to offer, right? Except for what my Heavenly Father has done for me. I am a sinner saved by grace, right? And so all of my righteousness comes from Jesus. All of everything that I own is because there's a God who made it his business that I would be here in this moment. Why are you here? Why are you here in this time? In 2025, the year of our Lord, why are you here? Because somebody loves you, right? He cares. I like that. It's because he cares. He cares for us. And so let us be faithful. Let us be grateful for the opportunities that we have in front of us, even to be able to come together and study in this way. Let us have our takeaways. Nursing is demanding. It's going to be hard. You're going to have some good days, some bad days. But this verse reminds us that happiness is found in embracing the work that we are called to do. Everyday activities, the everyday little things that you are doing, that's part of God's will for you. That's his provision for you. My kids coming in here, busting in on me during the live. Guess what? That's God's will. My daughter needs to see me working. My daughter needs to be able to come in and visualize what it looks like to chase after your dreams, right? The ability to find satisfaction in the work and the food and the drink and just enjoy life. Don't take those things for granted. And as you are going about your day, your goals, right? Remember your Lord, who has made it possible for you to experience all of these things. So thank you so much for attending this class. I just want to say every Monday, Mondays are not easy, but when we come together like this, it makes it doable, whether it's daytime or nighttime for you, being able to just say, hey, I am still a part of a community. We acknowledge our creator. We know that we are encouraged with testimonials. This is a free place to come and say, hey, I passed. We have a special gift for you as well, those of you who are passing. So please let me know when you do pass. And yeah, I just like sharing this journey with you. So thank you all for showing up and just encouraging one another. I will see you on Wednesday. And yeah, by God's grace, we'll go together. Philippines, I'm coming for you. I am also coming to London. I am also travailing. Just travailing. So if you want me to come to your country or your city, the best thing you can do is just send me a message saying, hey, if you come to this city, we'll be able to host a class here. We know this person will support you. We know this initiative is available to you, because that's how we grow. We literally grow by people reaching out and saying, go here, take here, especially when it comes to the nursing schools. I'm literally working with nursing schools because the students say, hey, this is my dean, this is my instructor, reach out to them. So I thank you so much for growing this community. Y'all stay safe. And if nobody has said it, you can, you will, and you must pass NCLEX. See you later. Bye-bye.